I'm Dr. Atencio. I am a board certified plastic surgeon at Westlake Dermatology in the downtown location at the Four Seasons Hotels Residences. Thank you for joining us in this webinar. We're going to talk today about breast augmentation. It's going to be a short presentation and then we'll do some questions. And so if you have any questions, type them in the chat and then we'll get to them all the way to the end. I'm also going to have our consultant who can help you with scheduling and all of those sort of things, some of the questions related to uh, financing and all of that. So let's get it started in this lunch hour. Breast augmentation. First, I want to do a little disclosure. All of the pictures that you're going to be seeing today in this presentation are of my patients that have given me permission. So please do not take photos and redistribute them as they are protected. Anyway, breast augmentation is the most frequently performed plastic surgery, not only in the US, but actually across the world. There's more than 300,000 cases that get done every year in the US. And why is this? It's because everyone is happy, everyone likes it. It has over 90%. Some people claim 98% satisfaction rate. So, it's a procedure where most people are really happy with their results. So it's easy for it to be popular. Breast augmentation is all about volume, is making something bigger. So fullness, projection, shape. There are a couple of things, however, that breast augmentation cannot do. And those are not, it does not correct drooping of the breast tissue. It does not change nipple position. And it does not correct asymmetry. So a couple of things to keep in mind when you're deciding what type of surgery you want or you need based on your anatomy. What we can achieve with breast augmentation is just volume augmentation, shape, fullness, projection, all of that. There's different types of incisions that we can make. Those are the scars. Most commonly is the inframammary fold that is at the fold of the breast. It's about 4 centimeters in length. It gets hidden very, very well. That is absolutely the most popular. The second most popular is around the areola, also very commonly performed. And then we have the axillary incision and the umbilical excision. Less and less, I think plastic surgeons are using these two. They have a little bit more complication rates. So they are not as common, but they're still available. So important to know. Then we decide the implant pocket. Where do we put that implant, right? It's under the breast tissue, under the muscle, or there's a layer that's in between those two, which we call subfascial. Each one of these pockets is good, is gonna have different nuisance between them. So there's a little bit more risk of rippling and palpability in the subglandular pocket, which is just under the breast tissue, especially if you're a thin individual. And as you go down a layer, then that risk gets lower and lower. Same risk of capsular contracture, slightly higher in the pocket under the breast tissue and lowest under the muscle. And pain and recovery, they're all very tolerable and the recovery is very, very similar, but it's a little bit faster when you go right under the breast tissue and a little bit slower when you go under the muscle. We have to make decisions of where do we put this implant based on your anatomy, but also on your activity level, how sporty you are, what kind of exercises you do, expectations, implant size, all of it comes into play. I just think it's very important that when you do decide to have the surgery, you have it with a surgeon that can offer all of the options, right? And just pick the option that is specifically good for you. Not everybody gets the same pocket, not everybody gets the same implant for the best results. So important to keep that in mind. Next, what kind of implant do I get, right? And there's 4 major companies that have breast implants, and we use them all. They're all very good. They're all safe. They're all FDA approved. They just have differences in terms of what kind of implants, what kind of silicone, what profile they offer, the warranty, the risks sometimes associated with them are a little bit different between companies. So we talk about all of those details in your consultation. Pick the best implants for you. There's two major types of implants, saline implants and silicone implants. The shell of the implants are the same. Saline implants are filled with water, silicone implants are filled with gel or silicone. And there's a little bit of difference between them. Saline implants are a little bit less expensive than silicone implants, but they do feel a little bit harder. They tend to not look as natural. Um, they do have the advantage that when the shell ruptures, it deflates, so you know that the implant is ruptured and you know that you have to change it. When a silicone implant ruptures, you don't necessarily know, but in the newer version of implants, that silicone is very sticky, so it doesn't spill out of the shell. They're all safe, they're all good. They just have a little bit of differences between them, and I'm gonna go a little bit more into detail in silicone implants because they do have a little bit more specific types. In the silicone implants, we hear this word gummy all the time. We hear it on social media. It's very popular. And what does gummy mean? Gummy means that it's sticky on the inside, that silicone doesn't spill out of the shell. Every company has different types of gummy implants. And within this, for example, this is the Natrel cohesivity levels. We have three different types of stickiness. But they retain their shape, they retain their volume under the muscle, also important, while still being very squishy and meant to feel like breast tissue. So silicone implants and gummy silicone implants are probably my personal favorite, but they're all, safe to use. And then it comes implant profiles, and this is basically how much that implants stick out. And we have every company has different names, but they go from low to extra full, and then a lot of in between. How much fullness, how much roundness you want at the top of your breast when you're not necessarily wearing a bra or a swimsuit, right? That's how I tell my patients how to pick that profile. Within the profiles, then there's different volumes, and we'll talk about each specific one of these characteristics for your breast type. We start with this, which is measurements. We start with math. We measure how wide your chest is, how much stretchiness you have in that skin. If you have very stretchy skin, then you are able to accommodate a larger volume for your chest width. So we'll make some of these adjustments based on math. And then the second more important thing of how do we pick implants is your preference of how do you want to look like. And that's very important because what you want visually, you need to translate to us. And I think the best way to do that is to get a couple inspiration photos. You don't need 10, you don't need 20, you don't need 30, but bring your three favorite pictures that you like how you want to look like. Sometimes actually even bringing pictures of how you don't want to look like is as helpful. And that will help me visually translate that to you, what that implant size, pocket profile, all of that is going to look in your specific anatomy. So inspiration photos are really important. And this is basically how high, how round you want your upper pole of the breast to be. This is another question. When you're not wearing a bra or a swimsuit, do you want your upper poles to still be round, to still be full, or do you want more of a natural shape? And natural breasts are flatter at the top, fuller at the bottom. And that's how we pick your profile. All of these things together are going to help us pick your implant. I always like to say this, do not get caught up in the details because, for example, in this picture, all of these patients have the exact same implant. And that implant is not going to look the same on everybody. And that's why inspiration photos are so important because I can let you know if your goals are attainable and if and what a specific implant is going to get you to that number. Makes sense when you see all of their before photos. You see all of their before photos. It makes sense that the same implant with the same profile, with the same volume is not going to look the same on all these bodies or all this skin stretch or all this patients. So inspiration photos, super, super important for your consultation. And then what happens when you decide to go outside of your base width? That's like an implant that is either too narrow, too wide, too big for your chest width. If it is too narrow, you lose cleavage, you lose that upper pole fullness. It's gonna look very, very natural. If you go too big, that implant's gonna be heavy. It can promote sagginess of the breast tissue. It can also displace down. That's what we call bottoming out. It can thin out breast tissue over time because it's super tight. If the implant is too wide for your chest width, sometimes you can, if it's too wide towards the center, you can create something that's called symastia, which is kind of like an uniboob. Or it can expand laterally, and then whenever you lay down, your implants will go to the side. So we have to stay within measurements of your chest width and then pick an implant that is going to be good for you, not only right now, but long term, right? You want to have long term results. You want your implants to look good years and years from your surgery. The procedure itself, very straightforward. We do it under general anesthesia. You go under, but it takes less than an hour. You go home the same day. You'll need someone to drive you because obviously because of the anesthesia, you'll be groggy, but very straightforward, very fast. The recovery itself, it varies depending on things that we do, but for the most part, 3 to 5 days where you feel tightness, soreness, some pain, very minimal swelling, very minimal bruising, no heavy exercise for 3 weeks, and no upper body exercises, pushing, pulling, heavy stuff for 6 weeks. That's how long it takes for that scar to heal and that pocket to settle. I see all of my patients a day after surgery, a week after surgery. We teach you how to do breast massages to keep that implant pocket soft, recommend different products for scarring. And then at 6 weeks to release you for normal activities, 3 months, 6 months, a year, make sure everything is healing well. Now I want to talk a little bit about trends. So what's out there, what is becoming more and more popular. The first thing is the ballerina boobs or the yoga boobs. This is a breast augmentation that's very, very natural. And we pick implants that are kind of low profile, that are gonna look cute, but they're small. They're gonna leave people guessing, did she have it done, right? They're also very sporty, right? They don't weigh too much, so it's not gonna prevent you from doing any kind of physical activity, and that's why they get that the name of the yoga boobs. The next, in the same trend of people trying to be more and more natural, I think fat transfer is also popular or becoming more popular because of that. Plus, you get the benefit of getting the liposuction on the areas that you have a little bit of extra fat that you don't want anymore. And then we get to transfer that to your breast. Fat transfer, very natural, very soft, is going to just maybe increase volume by a cup size. So I think it's becoming a lot more trendy towards natural results, small, perky, kind of cute breasts. Next is the Preserve. Preserve was created by Motiva. It's a less invasive procedure, has a shorter scar at the fold. It can be done under sedation. You don't necessarily need to go under general anesthesia. It preserves the natural breast tissue. They say easier recovery. I think that if you have regular breast augmentation or this, the recovery is essentially the same, but it does allow to use a smaller implant. You can put it in a location where we need the breast to be bigger, which is the upper central portion of the breast. The only downside of this is a lot more expensive than regular breast augmentation. But it's popular and it's trendy. So they have a really good video of how the procedure is done in their website. So you can see it there if you want to get a little bit more details about Preserve. Cleavage modifications, another thing I get asked a lot. If you have a wide sternum and your breast kind of don't touch in the middle, sometimes an implant and an augmentation is not going to get you that cleavage that you want. And in those cases, then we talk about cleavage modification. For this, we do fat transfer. It doesn't need to be a lot of fat, but we just put the fat right there in the center to bring that cleavage a little bit closer together. Internal bra has been popular for years now, and this is long-term longevity, right? We put this little piece of mesh that is going to get absorbed over a period of 1 to 2 years. It strengthens your skin and soft tissues. It holds the weight of that implant in your breast tissue. So we don't depend on the skin elasticity as much because we have this kind of insurance policy that's holding things together. And but it gets absorbed over 2 years, which we want. You don't want to have something there that's totally permanent. But it will help you preserve some of that fullness, that perkiness long term. Everybody that has surgery with or without an internal bra will have the same initial results, but then we rely on the skin stretch and how much ptosis comes back, especially in cases where we need to do a lift. For example, I find this particularly helpful. I don't think that necessarily primary breast augmentations, you're cute, you're young, you're gonna get a breast augmentation you need to have an internal bra. But when we're talking about lifting the breast tissue, I think it is particularly helpful there. Just to try to support that way, just to try to support those results long term. And then sometimes you need a lift. There's only so much we can do with just an implant. If your breast tissue is low, if your nipple is pointing down, those things we need to correct with the lift. If you have any questions, please type them into the group chat. This is our information, our location, like I said, is downtown. And now I'm going to introduce you to Avery. She is one of our consultants. She can help you set up all your appointments. Welcome. And then she's going to help us with all of our Q&A. So if you have any questions, please put them in the chat. And we're going to start with that part.
Okay, in regards to the presentation, we had a question. What are you referring to as far as rippling and palpability?
So rippling, the implants have, they're not like super, super tight. So they have a little waviness to it. And that can sometimes be felt under the skin. If you are very, very skinny and you get an implant in just under the breast tissue, you don't get it under the muscle. There's not a lot of coverage on top of that implant. And so you can sometimes feel the edge of the implant or see the ripples, especially if you're leaning forward, it can look like streaks, it can look like folds.
Okay. And also, what is capsular contracture?
Capsular contracture. So an implant is a foreign body. Your body is going to create scar tissue around it, and that's what we call the capsule. Some people randomly create too much scar tissue that it can be painful. It can become tight over time. It is a random event. It is not very common, but it can happen to anybody. When it happens most of the time within the first year. And that's why we kind of keep an eye out during those months follow-up appointments because I'm going to try to feel for that pocket, make sure that that implant is nice and soft there, and that it's not becoming tight, it's not becoming painful.
Okay, we have someone who's interested more about fat transfer. So they're interested in, does it help with perkiness and fullness? And then to confirm, it doesn't require implants.
So you can do both. Fat transfer on itself, no, it does not require implants, but you can add fat transfer to your implant surgery, specifically, like I said, to modify your cleavage. Fat transfer is great. I think it has the benefit from the liposuction as well as being your own tissue. So you don't have to worry about the implant rupturing or changing the implant or having another surgery in your lifetime because when we transfer fat, that fat becomes part of your breast tissue. It gains weight with you. It loses weight with you. It's going to change with you over time. So you don't have to worry about that. Those are the benefits of fat transfer. Some of the downsides of fat transfer is not all of the fat that we transfer survives. There's a little bit of unpredictability in terms of your final volume, and you have to be open-minded about that. And then it doesn't change shape. Whatever shape you had before, you're going to have later, just bigger. It doesn't give you that roundness in the upper pole when you're not wearing a bra, like an implant would do. If you're looking for shape that's there when you're not wearing anything, then the only thing you can do is an implant.
Okay, and then with fat transfer, how long does that usually last? And in addition, do you have to do lipo? And what if you're a smaller person? How many areas?
Yes. So, how long does it last? At the beginning, the volume that we inject is gonna take maybe like the first 6 weeks. Some of it is gonna get absorbed. After that, it kind of becomes a little bit stable for the 1 year. And then it depends on your weight. If you lose weight, you're gonna lose weight there too. If you gain weight, you're gonna gain weight there too. And aging is a process too. So over time, you're gonna lose it like you would breast tissue. Over time, when we get older, women, we lose volume, especially on our upper poles. So that fat is also going to get lost in the same way that you would your breast tissue. And then how many areas? It depends on how much fat you want us to transfer, how much fat is available per area of liposuction. If you're super, super skinny and you don't have any fat, then my recommendation would to do Alloclay. Alloclay is a product that came out about a few years ago. It's cadaver fat that has been processed that we can inject in the breast. It is it comes in different sizes, so we can talk about like different sizes of those syringes and how much volume you're gonna need, and that would be kind of the get around if you're too skinny and really don't have any fat available for transfer.
Okay, next question is what is the recovery time for a breast lift?
Same actually as breast augmentation, 6 weeks of no upper body exercises, so no pushing, pulling, anything heavy. Uh, Pain probably about a week of work. After that, you can go back to work, go back to light activities about 4 weeks after the surgery. We're really just protecting those scars. Those scars are very thin. It takes time for them to heal. You don't want to be doing anything stretchy that may widen that scar. So about 6 weeks of upper body physical restrictions, 1 week of pain and of work.
Okay, the next one is if you have a capsular contracture on one side but not the other, is it still recommended to get both sides replaced? And is this more invasive if you're needing to correct this?
So yeah, when we have to correct capsular contracture, it's definitely a bigger surgery. When you have a capsular contracture, we have to remove that capsule in its entirety. So very meticulous surgery. And then we talk about how to prevent it from coming back. And when we talk about that, there is a specific type of mesh that has been studied to decrease the risk of recurrence capsular contracture. So it is definitely a lot more involved than the first time around. And then the question about sides, it depends. If you just had surgery and a year ago and you like your size, no, you don't have to change the other side. But if you get a capsular contracture and your implant surgery was 15, 20 years ago, then yes, because sometimes the breast is now more saggy, and even though we would try to make it symmetric, is very hard. Once you remove that scar tissue, it's very hard to make it match the other side. So if it's been only 1 year, you don't need to change both implants. But if it's been, a long time and things have changed, then I would probably suggest doing both.
Okay, after having a breast augmentation with an implant, can you still breastfeed?
Yeah, most people can. We do this surgery mostly through the fold. When we do the surgery through the fold, we really don't get close to the milk ducts or any of those structures. So in theory, if you were able to breastfeed before an implant surgery, you should be able to breastfeed afterwards. There's always a risk of not being able to breastfeed with any kind of surgery, but it's very, very low when you use the inframammary fold as your incision. Um, Same with nipple sensation, other things like that are risks with surgery. They're never zero, but they're very, very low. The thing is that some women can't breastfeed even without any type of breast surgery. So we always have to say there is a risk that you wouldn't be able to breastfeed, but having an implant should not completely preclude you from being able to do so.
Okay, and then where do you perform surgery?
We do surgeries here. It's very convenient. In our office, we have our own operating room, and we are located downtown at the Four Seasons Residences. We have parking and validated.
You
So
do?
it's very easy. Yeah, it's very easy to find us. And all of your appointments are here. Your surgery is here. This is where we see you in anytime.
Okay, I mean, that is what we have for questions for
Perfect.
now.
So thank you so much for joining us. If you have any other questions, you're gonna get an email after our webinar today with information with our email address where you can reach us, and I'm happy to answer any questions that you have. It's also super easy to make a consultation. I love consultations because you really don't have to make any decisions. It's a day where we talk about you, we talk about your anatomy, we talk about your goals, what implants, what surgery is the one that's going to benefit you the most. And then you get to make decisions, which is fun. So very, very nice to meet you all virtually.
Mhm.
And thank you for participating.
Bye.
Bye.